morning, good afternoon, and good evening, everybody. Welcome to another week of the Global Cafe. My name is Elizabeth Lewis, and I'm a Senior Project and Policy Coordinator here at the International Federation on Aging. And I'm super excited to introduce you all to Miss Ceilagh MacDonald. Ceilagh grew up in Halifax, Nova Scotia, where she completed her BSc in Neuroscience at Dalhousie University and followed by a BA in Honors in Psychology at the University of at Toronto Metropolitan University in Toronto. She is currently a doctoral candidate in the counseling psychology program at McGill University, where she focuses her research on understanding the experiences of family caregivers of persons with dementia. In addition to her research, she also works as a psychotherapist with the Montreal Therapy Center. Kayla currently lives with her family in Halifax and enjoys trying as many craft hobbies as she can, including with mixed success, embroidery, beading, and quilting. So thank you so much for joining us here today.
Thanks for having me.
So just to get to know a bit more about yourself first, could you walk us through your journey into researching Canadian caregivers and where your passion for researching caregiving first began?
Yeah, totally. Like you said, thank you for the introduction. Um, I did my Bachelor's of Science at DAL in Halifax, and then moved on to a BA in Psych at Toronto Metropolitan University. When I was there, it was Ryerson. And it was there that I kind of got my start in psychology research. Um, I had the opportunity to volunteer at St. Mike's, which is a hospital in downtown Toronto, um, where they have a really great memory clinic. So they do assessments with folks in the community who are experiencing lots of different kinds of memory issues for lots of different reasons. And it was there that I kind of got my first taste of persons with dementia. Um, and then I started moving into other research projects that would be associated with like neurodegenerative diseases, including dementias. Um, and I kind of like, I was really excited to work with the patient populations. I was young, I was fresh. I was like, yes, patient populations, so exciting. And then when I was working with them, I was like, wait a second, there's like this other population that we're not really focusing on, which is the families. Um, and I didn't get to know them as well as the patients because I wasn't doing assessments with them, but I could see when they came in the stress that they were experiencing and the amount of time they were dedicating to their family member. And during my time at St. Mike's, my dad was actually diagnosed with vascular dementia. So there was like a personal connection there. And when I
Mhm.
pursued graduate studies at McGill, um, the lab that I got into had more to do with compassion and like models of compassion for others. And I knew that I was really interested in working with caregivers. My mom is my dad's primary caregiver. Um, and it's funny, she called me one day and she was like, on CBC, I heard this thing called compassion fatigue. Like, you should research this. I was like a month into my doctoral program. I was like, oh, like I'll look into it. So it was kind of inspired by her, but also almost suggested by her, which I think is like
Mhm.
a nice personal connection for me.
Mhm.
Um, and it turned out that there was not that much on family caregivers and compassion fatigue.
Mhm.
Um, so I was kind of like, oh, maybe like this is almost like fate, kismet. This actually could be a project. Um, and I convinced my supervisor that compassion fatigue was close enough to compassion that I could research it under her supervision. And it's kind of been since then that I've just been pursuing that research.
Very nice. Thank you for sharing all that. And so I think you've already answered a bit of it, but do you think that your lived experience played a role then in your interest in studying dementia specifically?
Yeah, for sure. There's so many different kinds of caregivers.
Mm.
Um, and that's what I learned when I first went into the caregiver literature, especially like professional versus informal versus family. Um, it was going to be too big
Right.
for a dissertation, even for a dissertation.
Hmm.
Um, and I had the personal connection, and I had previous experience with the caregivers in like a professional setting as well.
Hmm.
Um, and I really think that research should be, I don't know, I think you should have a personal investment in research almost.
Yeah.
Maybe not quite as close as I have but there should be some kind of, I don't know, drive in that way, I guess.
Absolutely. That's lovely that you have that experience to be able to share on as well. Um, in in studying caregivers, can you speak to some of the roles and responsibilities that caregivers for persons with dementia typically take on?
Yeah, totally. It's funny. When like we spoke a little bit about this before. Um, I think like all of them is the easy answer or the quick answer. There's like their regular daily activities and like things that they have to take care of, as we all do. And then there's also like the activities of daily living, for their loved one. There's like financial things that they eventually have to take on to navigate their finances. There's the healthcare system that they have to navigate. Like it really is like a full-time job on top of their regular life.
Hmm. Hmm. And so, what are some of the impacts then, or changes to daily life that can come with taking on a caregiving role?
Yeah, I mean, like practically speaking, there's like time off work for appointments.
Hmm.
There's like lack of time with their own family. Sometimes, like if the caregivers have small children, if it's like a child of a parent, there's
Hmm.
less time to do things with their own family. And I
Hmm.
think it's a lot of like time and stress and emotional burden that are the kind of
Hmm.
the drawbacks,
Hmm.
of being a caregiver or limitations.
And who demographically typically takes on the responsibility of caregiving for somebody with dementia, say on the non-paid side of things?
Yeah. So it's funny, I just finished recruitment for my qualitative study for my dissertation. And it was actually a really nice distribution of lots of different kinds of people. I mean, I'm going to be honest, it was only 10 people because it's a lot to analyze for a qualitative study for interviews, but there were um, there were men, there were nieces and nephews, there were daughters, there were sons, there were spouses. It's a lot of, it seems like there's a lot of varied experiences and varied, like demographics of people who are doing the caregiving.
Hmm. Hmm. And I want to address this comment that I see in the chat here before we get too deep into the conversation. I see a comment from Dominic saying, "Thank you for addressing this topic. I prefer the use of the term care partner as it affirms that the person with dementia is doing the best that they can to look after themselves." I think that's a really beautiful and lovely comment, and I want to ensure that we're addressing this topic in the most appropriate way. Do you have any thoughts on what terminology is best to use when addressing caregivers or care partners?
Yeah, I think that's a really good point. And thank you for making it. I mean, I guess I'm kind of, I'm obviously not using the right, um, or the like that preferred terminology, mostly because that's what I've seen in the literature. But it's good for me to know, like going forward publishing, like I want to make the changes that need to be made in the literature as well. So to like change it to care partners, I think is a really good, um, suggestion for me to take on. So I really appreciate that.
Yeah, and Valerie also hopped in the comments and said that in the UK they use the term carer. So it looks like there's a bit of variety
Mm.
there in the terms that are used. But thank you all for mentioning that there. I want to talk a bit more directly about your research as it centers compassion fatigue in particular. Could you define and explain what compassion fatigue means for those who maybe are less aware?
Yeah, so I think compassion fatigue, there's lots of like there's kind of, a debate in the literature about what compassion fatigue is, and then if your compassion can truly be fatigue. So if it's like a bucket and it drains, like can your compassion fatigue actually drain in that kind of way? But the way that I conceptualize compassion fatigue is kind of like burnout, which is when in a position in a job, um, the demands exceed your resources. So it's too much, you don't have enough resources to attend to all of the demands of the job, plus secondary traumatization,
Mm,
um, which is being exposed to somebody else's suffering.
mm,
And that's what causes, like stress, anxiety, difficulty expressing compassion, for their loved one. And this was, created for professional carers. So most of the literature in this area is on nurses, doctors, social workers, um,
Hmm.
because they have a job, and that's kind of like the burnout part of things. Um, I actually contacted the father of compassion fatigue, who very kindly responded to little first year grad student me, because I wanted to know if he had pursued this in family caregivers, and it's not something that he has pursued. So I was kind of interested to see how, um, like I guess the way that I conceptualized it is that it's a role. Being a
Hmm.
carer or a care partner is a role. Um, and it's very likely that in that role, the demands could exceed your resources. And
Hmm.
you are exposed to somebody else's suffering.
Hmm.
Um, and what does that look like? Does that look
Hmm.
different in informal and family care partners or carers? Or does it look completely different? So that's kind of where I've been taking my research. Um, so far in the qualitative study that I've been doing, um, I'm not sure that they do experience compassion fatigue. So my hypothesis was that they would,
Hmm.
um, but it seems like there's a buffering effect of the relationship with their loved one.
Hmm.
Um, and that's been a really cool thing to see, even though it is not in line with my hypothesis, which um, is fine, and I think is actually more interesting than if it was.
Yeah, could you explain a bit more what you mean by that buffering effect there, or how their proximity to their loved ones would impact the sort of fatigue or burnout that they're feeling?
Yeah, I mean, full disclosure, I have not done data analysis, so I'm not going to report on formal results, but it seems that the relationship is almost a protective factor
Mm.
for experiencing compassion fatigue and burnout. Um, Even when the relationship is not as close as
Mm.
others, it seems like that attachment is still really important,
Hmm.
um, in their well-being, in
Hmm.
the carer's well-being.
Hmm. No, that's really interesting. I remember, just on a side note here, the IFA did some research last year surveying caregivers for folks living with dementia. And I think one of the interesting findings that we found as well was there was high rates of um, stress and anxiety and exhaustion from the roles that they took on as family care partners. However, they also mentioned a lot of the times that they wouldn't want anybody else to be the one to provide care, or they wouldn't want to pass that responsibility on to anybody else. And they found a quite a great deal of accomplishment and meaning through the work that they provided as care partners. So I think that's interesting to see how those two things can coexist at the same time, and it doesn't necessarily mean that it's a responsibility they want to pass on to somebody else or let go of. So it's really interesting to see those complexities.
Yeah, absolutely.
Mhm. So just in terms of defining compassion fatigue further, how do you define and distinguish concepts like compassion fatigue, burnout, and empathy distress in your work? How are those terms different?
Yeah, so the way that I conceptualize it, Figley has a really great kind of flow chart that looks at like the contributors to compassion fatigue, and protective factors from. But I really do look at it as like kind of like boxes, like demands have to exceed resources, and
Hmm.
they have to be exposed to some kind of secondary traumatic stress, or they experience secondary traumatic stress but are exposed to somebody else's suffering. Um, and that results in that kind of like depletion or empathy distress. Um, there's lots of different ways to define it, I think, and like colloquially, that's not really, I think, how we hear about it in the media, but that's
Hmm.
kind of what the definition that I'm using right now for my dissertation.
Okay. And do you find that carers themselves use the term compassion fatigue, or do they tend to describe their experience differently that you then sort into being compassion fatigue?
That's a really good question. I like yes and no, I guess is the answer. Some do, but I think most, like I almost wonder if calling it compassion fatigue is a bit reductive at this point, where there's stress and anxiety, and there might be some feelings of resentment towards their partner or their loved one. Um, and then there's guilt associated with that resentment because they don't want to hand that role over to anybody else, but they're feeling these feelings. And I think I don't know for sure because I haven't spoken to all of the caregivers or done any analysis yet, but it does seem like, I don't know. I don't know if it's enough to describe just using the word compassion fatigue.
Mhm. I'm seeing some really interesting comments in the chat here as well. It sounds like we have some folks with lived experience. So I would just suggest if anyone here who would like to comment on the conversation we're having thus far, please feel free to raise your hand and share some of your own experience as well if that's something that you'd be willing to do. But thank you for your comments that you're leaving right now. So just continuing on in the meantime here, what are some of the sort of the gaps in literature or practices that you're aiming to address in your research?
Yeah, so the main gap when I started was, where does compassion fatigue fit in the family or
Mhm.
informal care partner or care literature? Um, and that continues to be part of the goal,
Mhm.
because I think there is I think there were like 5 studies when I started in this area compared to the professional literature where there were thousands. Um, so kind of trying to understand that a little bit better, but also bringing attention to this population that doesn't really seem to be
Mhm.
being served by either research or policy,
Mhm.
um, and just trying to understand better the complexities of their experiences.
Mhm.
And I guess like giving them a voice a bit more. Um, yeah, I think those are the bigger, maybe not gaps in the literature, some of them, but goals overall for my research.
No, absolutely. I think it's very important to provide a platform for caregivers to share their own experience as well. And so it's a common feeling to feel isolated and excluded. And I think it's really great work that you're doing. So thank you for sharing with us here today. Another question here for you is, I'm wondering how you've found that compassion fatigue intersects with concepts like anticipatory loss or moral distress and grief. Do those emotions play a role in sort of the fatigue or exhaustion that caregivers experience, do you think?
I think for sure. And I saw Dominic's comment, like ambiguous grief and yeah, like anticipatory grief, all of those things
Mm-hmm.
really factor into the experience, I think.
Mm-hmm.
Whether they directly play a role with compassion fatigue, I mean, it's another stressor for sure. Um, and almost like exhaustion. Like I could understand feeling like you go through this grief over and over and over, and
Mm-hmm.
eventually it gets I don't want to say desensitized, but like somewhere along that spectrum of, okay, I'm grieving again. Like this is really, really hard, but oh my gosh, this is so much stress. Um, and just feeling fatigued by so much emotional load.
Mm-hmm. Mm-hmm. No, thank you for explaining that further. I see another question in the chat here from one of our cafe regulars, Shmuel, who is asking, how can researchers, sorry, how can researchers support improvement of well-being of Canadian caregivers?
Yeah, that's a great question. And also one of my dissertation questions. Um, and I think from the caregivers that I've spoken to, it seems like policy is something that really needs to be changed. Um, there's like this very distinct experience of care partners or carers who are in the healthcare system, who have been nurses or support workers, um, or doctors, and carers that have not been part of the healthcare system.
Mm-hmm.
And the carers that have been part of the healthcare system, it's incredible. They're thriving. They've got all the supports. They knew where to go to get those supports. Where the carers that haven't been part of the healthcare system, seem to be struggling a lot more in those areas, like accessing resources, knowing where to go, and having more information or support for them, I think could be really helpful.
Hmm.
Um, it was interesting, actually, like I think 4 out of the 10 carers that I spoke to said the same thing. They wanted a like a database with all of the information like very clearly explained,
Hmm.
or like a social worker in like in kind of each hub,
Hmm.
to help explain and help navigate. And I think that those are such important things. Like right now, it seems like it feels, I mean, I can speak from personal experience too. It feels very disjointed. There's like a
Hmm.
website for this over here, and then you kind of have to figure out where to go over there.
Hmm.
Um, and if you haven't been part of the healthcare system before, it feels impossible.
Hmm.
So I think it starts with the policy changes,
Hmm.
and like funding for resources.
Hmm. Absolutely. And I'm seeing in the chat here as well, Dominique is suggesting in Nova Scotia, the Alzheimer's Society has an extensive support system for care partners, including support groups and counseling. So Alzheimer's Society is certainly a really great resource to point people towards. Do you have any other suggestions of resources that folks could check out if they're unsure of where to start?
I think the Alzheimer's Society is a great place to start. Um, Sorry, I'm also in Nova Scotia, Dominic, so I'm happy to hear somebody else from here. I actually haven't interviewed anybody from Nova Scotia. I interviewed somebody from Newfoundland, um, where resources were sparse, let's say. But I think Alzheimer's Society is a really great place to start, um, to kind of get a feel for what the resources are in your area, or to be able to reach out. Um, there's been mixed kind of reviews, I'll say, from the
Mhm.
caregivers that I've seen, but I'm happy to hear that it's really extensive and helpful in Nova Scotia. Selfishly, I am happy to hear that. Um, yeah.
Perfect. And I want to sort of go back a bit into sort of your methodological choices and considerations in doing your research. So just I want to know why you chose a qualitative approach or a mixed methods approach if you are doing that as well, to studying the caregiver experience and what the approach that you've chosen can benefit or sort of limit as well.
Yeah. So when I started grad school, I was like a very staunch quantitative researcher. I was like questionnaires, we will get like a number, it'll be great. And then then I was like, okay, wait a second, this is way more complicated than numbers. Um, but I think that so I'm doing a quantitative study and a qualitative study. I think that quantitative sometimes is like an attention getter,
Okay.
for to be like, okay, look, like I have numbers and data, like let's look at this more.
Hmm.
So I guess it was a bit strategic to do that as well.
Hmm.
Um, the qualitative I chose because it was just so much more complicated than the numbers would tell me.
Hmm.
Um, and I really wanted to talk to caregivers. Like if there was such little research in this
Hmm.
area, like let's get some caregivers in here and tell us what their experience has been. I think like participatory action research, like getting the participants involved, is so important.
Hmm.
Um, and really understanding that they're the expert,
Hmm.
in this experience, and I'm just trying to learn from them, and learn how I can like somehow help them in some kind of way with this research. And then broader, like how can our policies and our healthcare system help them?
Absolutely. Yeah. No, thank you for sharing that. And I think the IFA comes from a very similar spot as well, where we have done extensive research in surveying Canadian caregivers, but we're currently now also taking on a project doing qualitative interviews as well. So just to throw it to the audience as well, if anyone here is a caregiver for somebody with dementia and does want to contribute to either study, then please do feel free to reach out. We can put my email in the chat here as well. And we certainly want to continue to amplify voices as well here. And Dominique, I see that your hand is raised. Did you have a comment that you wanted to say out loud?
Yeah, please. And it's
Perfect.
wonderful to hear this. I helped my mom through her dementia journey, and I got very involved with the Alzheimer's Society here in Nova Scotia. I currently run a support group for care partners.
Mm.
I was going to mention that we recently started up a Music and Memories Cafe here in Pictou County. And the great thing about these cafes is the person with dementia can come along with their significant other. And we have music, we have discussions about different topics, we use art, we use, various modalities. The idea behind this is that oftentimes when people start to develop dementia, their friends drift away, and sometimes family members do. So this is an opportunity for them to come and enjoy time with their significant other in a warm and comfortable place without any stigma. And ditto for the care partner, because sometimes they can feel very alone as well.
Mhm.
But this is a very much a topic that's near and dear to me. As a social worker, I gave a workshop on this topic a number of years ago to my colleagues, and we particularly looked at things like anxiety and the ambiguous grief stuff, along with shame and guilt and anger, as key things that people can experience and often need counseling with.
Mhm.
So I'm really glad that, Kaylee, that you're doing this research. And if there's anything I can do to assist you with it, I'd be very happy to. Thank
Oh,
you.
that's amazing. Thank you so much. That's an amazing program. I love that. Because yeah, isolation is such a huge thing for the care partners and the individual with dementia. That's incredible.
Yeah, there's about 14 or 15 of these cafes around the province now.
Okay.
And the Alzheimer's Society, it's supportive of them, but it doesn't actually run them. They're a separate thing. Dr. Beverly Cassidy heads up
Okay.
a network of these cafes, and you might have come across Beverly at some point. Yeah,
Yeah.
Well,
yeah,
thank
she's
you
a
so
great.
Yeah.
much for sharing them. That's lovely to hear sort of innovative programming like that. And it leads to a question, I guess, for either of you here, if you'd like, Dominique, or how does the role of music or activity play a role in supporting caregivers and folks with dementia? What sort of emotions or positive sentiments does music in particular bring out?
Oh, happy feelings. People
Yeah.
remember songs, they remember the words, they sing along, you are my sunshine, songs like that. And music, you may know, is one of the last things that sort of disappears in the
Hmm.
journey with dementia. That people can be lying in bed and not doing anything, and then you play some music for them, and suddenly they perk up. It's
Hmm.
incredible, the effect of music in producing positive emotions and
Hmm.
feelings of togetherness.
Hmm.
We're all singing together. So it's really wonderful.
Thank you so much, Dominique. And
Mhm.
I really appreciate you sharing your knowledge with us as well here today. It's lovely to hear voices of our attendees as well. So thank you for sharing with us. I do see
Thank you.
also Dr. Aisha is wondering for details of the cafe. So if you have any other details to share in the chat, please feel free to put that down below as well. But moving forward to some questions for you here as well, Kayla. So I'm
Mhm.
wondering as well, how have you navigated in your approach with caregivers in particular? I know you have some lived experience to speak on as well, but are there any sort of power dynamics or emotional vulnerabilities that come up in interviews with you, and how do you navigate those complexities?
Yeah, I think, I mean, inherently it's like a very emotional, close to their hearts, close to my heart,
Hmm.
conversation. Um, in terms of power dynamics, I, in general, strive to kind of minimize them as much as possible. I'm really there to hear from them. I try not to impose structure wherever they want to take it as much as possible. I'm there for the ride. Um, but I self-disclose that this is near and dear to my heart too, and that I have a shared experience. Um, and I think that can help kind of reduce that power dynamic. Like I'm not um, like I'm not just a researcher.
Hmm.
This is part of my personal life too, and it's really important to me. And like just showing them how important it is, and it is really emotional. But it's funny. I think that caregivers are, or the family carers are some of the funniest people that I've met, especially in the context of research. But they have like a very um, I would say like adaptive,
Mm,
like it's like almost like a coping strategy. There's like a very funny, sometimes dark humor that comes with it, and it's really inspiring to see their resilience through
mhm,
that. Like it's obviously very important and very heartbreaking for them, but they're also a few of them have said like if I don't laugh, I will never stop crying. So there's um, yeah, there's that some kind of like resilience in them that I think is really admirable.
mhm, mhm. Absolutely. No, thank you for sharing that as well. And some of the research that the IFA is doing again with caregivers now is wanting to explore the homogenous nature of the caregiver experience and how there's such variety in what caregivers experience across sort of their identity and demographic differences as well. Could you comment on what you found in terms of how the caregiver experience can differ based on one's gender or race or sexual orientation or age even, and how to ensure that those populations are well represented in research?
Yeah, I think I mean, stereotypically women are the caregivers. I think that's like a pretty well-known stereotype. Um, and I mean, most of the caregivers that I saw or carers that I saw were women, but there was a subsection of men as well.
Mhm,
So I think making sure that we do pay attention to the male caregivers is really important.
mhm,
Um, I think they might have different needs.
mhm,
Um, but I mean, everybody has different needs, right? Like it's such an individualized thing that I think having some kind of central portal, for lack of a better term, so that
mhm,
people can go and pick the things um, that they need and that speak to them could be really helpful.
mhm,
Um, yeah, I mean, I've, like I said, I've seen like daughters, sons, nieces, nephews, partners, um, like immigrants, even recent immigrants who don't have family doctors or don't have health cards and trying to navigate that within the system as well.
mhm,
Um, so I think knowing that it's not homogenous and that those stereotypes are not necessarily accurate, um, whether they were accurate then, but they're certainly changing now,
mhm,
is really important.
mhm.
And some of that is like challenging our own stereotypes too of what a carer looks like.
Absolutely. And have you seen any differences in how compassion fatigue in particular impacts different care partners based on their proximity to the person that they're providing care for? So say if it's a niece or if it's a sister or if it's an uncle or whatever the relationship is, have you seen a difference in how compassion fatigue impacts different carers?
It seems like the grief, the anticipatory grief from this small sample hits harder in um, like children of
Mm,
like seeing their parent change from their parent to almost them being their parent. Seems like a really difficult role reversal.
mhm,
Um, and yeah, and I can understand that for sure. But so far that seems to be like the most difficult
mhm,
um, yeah, relationship for
mhm,
compassion fatigue and grief.
mhm. And in terms of the anticipatory grief aspect, how does that come up in interviews, or how do you conceptualize that? And could you explain that concept a bit more for our audience?
Yeah, so anticipatory grief in plain language is grieving before you've lost the person to death. And I think that's something that's quite unique about dementia and other neurodegenerative diseases is that you lose the person before you lose the body.
Mm-hmm.
Um, and it's really difficult, it seems, to reconcile that
Hmm.
this person is still your loved one, but they're
Hmm.
not really your loved one. So you're grieving a different kind of death
Hmm.
um, than physical, final death.
Hmm.
Um, and I think that that kind of grief comes up at every kind of decline that you see in your, or can come up in every decline that you see of your loved one. Um, from when it starts to like forgetting to turn the stove off or forgetting people's names and like going all the way down to like not remembering who you are, not being themselves, personality changes. Like there's lots of opportunities, unfortunately, for anticipatory grief with dementias and cognitive decline.
Mm-hmm. I'm curious as well if you've noted if there's any element of sort of this identity shift or role loss that plays a role there in no longer being someone's care provider or no longer being somebody's sister, or how someone's identity would come into play there as well.
So that's something I was really interested in, is like the transition out of caregiving.
Mm-hmm.
Um, and it was a little bit too big for for the dissertation to study that too. But I'm kind of it's been like, I think the question is almost, what do you do in the aftermath of this enormous loss? How do you cope? How do you become like almost you again? Like there's this huge role loss, like you said,
Mm-hmm.
of what what do I do now?
Mm-hmm.
Um, Along with, I've lost this person and I'm devastated to not have this person in my life anymore. Um, from what I've seen, there's kind of like there's almost like a relief sometimes, whether it's a relief that the loved one isn't suffering or relief that they can have some of themselves back. And then there's some
Mm-hmm.
grief associated with that relief sometimes.
Mm-hmm.
But I think it's a really interesting area of topic of like, how do you transition out of being a caregiver? Um, but it's just not, it wasn't within the scope of this project, unfortunately.
No, yeah, that's fair enough. It's hard to put boundaries on research sometimes, and sometimes you have to make cuts where you need to. Um, but just moving out a bit more here, I'm curious in terms of sort of the larger policy scale implications, um, and sort of structural changes that need to be made. I'm wondering what you would suggest the role of sort of the municipal, the provincial, and the national levers for policy and health and for policy should be as healthcare is provincial.
Right. Um, I guess it sounds kind of blanketed, but like more funding would be great. Um, and more funding to organizations like the Alzheimer's Society or like grassroots organizations who are speaking to caregivers and can get their feedback. Like I think the caregiver or the carer's responsibility and carer's involvement in the policy change should be happening at all three levels.
Mhm.
Um, but like I also recognize that these are big recommendations to and big changes to make. So I think starting with just like more funding,
Mhm.
more involvement with the caregivers or carers in any capacity would be really helpful at this point.
Mhm. Mhm. And how do you think your research can be applied to a policy, a call for policy or call to action? And okay, I guess from your research as well, what sort of policy changes or structural changes are caregivers looking for?
Yeah, I think I hadn't really intended, and maybe naively, on commenting on policy within this
Mm-hmm.
project, but it really came up
Mm-hmm.
um, in almost every interview, and I think it is really important. And I think, sorry, I totally blanked on the second part of your question. I was excited about policy change.
No, not a problem. Sort of what types of or policy structural changes are caregivers looking for,
Mm.
based on the research that you've done so far?
I think, like I said, more funding to allocate towards somebody like a social worker who can help navigate just the system, not even their own mental health, but just help them with like accessing services or knowing who to go to for certain services and like what are they even qualified for in terms of even tax breaks or
Mm-hmm.
any of those kinds of things. It's already such a huge mental load. How do we reduce that?
Mm-hmm.
Um, and it's really hard to reduce that because we want to be the carers for our family members. So
Mm-hmm.
how can we make it easier for them?
Mm-hmm.
And I think the only way to figure that out is to hear from them themselves.
Absolutely. Yeah, absolutely. And another question that's similar to the transitional role of caregiving, as we spoke about before, I'm wondering if you have any knowledge about sort of the transitional experience that folks experience when people with living with dementia enter into, say, long-term care support or receive different forms of structural supports, and if there's any research there on sort of those transitions into long-term care facilities.
Yeah, I mean, from what I've seen, again, it hasn't been it's not the main focus of my research, but
Mhm.
there's kind of mixed feelings, it seems like, whether it's relief that, okay, like I finally have some help, I have some support, this feels great, but also guilt for putting them there, especially if they don't want to go. Um, to being able to live in that facility with them. There are some great facilities, especially in Ontario, that I've heard about, that the care partner is there with them,
Oh, interesting.
um, and they can go, like it's um, like an enclosed facility almost, and they can go to their activities. Like it's almost like it's like a long-term care home for both,
Mm,
um, with varying supports as needed. Um, And the person that I talked to that was in it was thriving and loved it and was like, this is amazing. This should be everywhere. But again, that person was part of the healthcare system before,
mhm,
so they knew where to go,
mhm,
which is such an asset. But I guess my goal is to get everybody to have like even the playing field a little bit.
mhm, mhm. Some really interesting comments in the chat here from Sandrine as well as Steph. If either of you want to read your comment aloud, please feel free to raise your hand or unmute. Otherwise, I'm happy to read either of your comments out myself, but I'll just give you a moment here.
Sure.
Okay, so,
Hi.
oh, go
Sorry,
ahead.
I'm not showing myself because it's so early in the morning
No
and I have
worries.
allergies. Does your research, Kaylee, cover carers who are not very willing or loving participants, but circumstances are such that they become a person's caregiver?
Yes, that is a really good question. And it very fortunately has, because I think that is a big part of this too. You don't really have a choice when your loved one gets dementia. That's not within your control. And there, I think from what I've seen, there's more distance, there's less like engagement, um, in the even in the interview, um, which I think is really interesting. Um, but it's definitely a smaller subset, mostly because I think they wouldn't want to participate. Like if they're already unwilling, they're probably less willing to participate in like a research study, about it.
It's a really interesting. Oh, sorry, go ahead, Steph.
No, I hear you. I'm thinking of like ex-spouses in
I haven't seen
particular,
any.
so complex relationships.
Mhm.
Yeah, I haven't seen any ex-spouses. A nephew that I saw was the uncle's power of attorney, so it wasn't that they had a close relationship. It was like a legal thing, um, and yeah, there wasn't as much. There wasn't as much fatigue, but there wasn't as much satisfaction in that care role either.
It sounds like a complicated experience to capture, though, for sure, and very interesting. Doesn't mean it doesn't exist just because it's hard to capture.
Yeah, an ex-partner would be very interesting, to interview or to understand their experience.
Absolutely. And some more comments coming in the chat here. Carolyn was asking, do you happen to know the name of the long-term care facility that also engages with caregivers directly? If you know that, Kayla, please feel free to pop it
I
in the chat.
don't I don't know it off the top of my head, but I can when I can go through the interview and I can see if I can find the name of it, and I can send it to you, Elizabeth, and you can.
Perfect. Oh, I I don't. Oh, there we go. I don't know what happened there. But yeah, Carolyn, if you want to pop your email in the chat, we can find out what that long-term care facility is and send some more information to you as well. We have another question here from Sandrine. If you would like to read your comment aloud, please feel free. Otherwise, I can read it out for you here.
Okay, thank you very much. Yes, so my question was, could you discuss the experiences of caregivers who are balancing their caregiving responsibilities with part-time or full-time employment? And in this context, what policy changes would be relevant or necessary in Canada, in your opinion? Thank you.
Yeah, so I think this is a huge one, especially for children of the person being cared for. And there are so many challenges. I think just how many hours in a day to do all of the things is the main one. And I think some of the challenges, they can't get their loved one into a long-term care home near them. Or as a result, they have to have the loved one come live with them. And then that poses a whole new set of challenges on their own family, as well as the relationship with their loved one. Sorry, I'm just reading. I'm getting off on a tangent. I'm rereading your question. Again, I think that support from a social worker or somebody or like a database just removes some of that time burden of just researching things and having things there when they need them. A big theme was you don't know what you need until you need it. And then you have to go searching through all of these different places and you're not really sure if you're doing the right thing or if you're going to the right place. And that takes up a lot of time on an already time burdened person who has a full-time job, who has a family, who is caring for their loved one. So just like those logistical changes, I think could be a lot more powerful than they seem at face value.
Right. Okay, thank you. I was kind of curious in terms of the policy change aspect, whether you would suggest to have some to implement some policies within work organization or mainly at the municipal or provincial or federal level in Canada. So I was kind of curious in terms of if you had heard in your interviews anything regarding the workplace policy specifically. Um, but if not, that's okay. Thank you. Very interesting research.
I think from what I've heard, it's been kind of mixed. It depends on the employer, but something that I think is really kind of a game changer is now the hybrid work model, where employers seem to be a bit more flexible about working from home. That gives people time to go to appointments or do what they need to do. But for sure, having something, I don't know exactly, like I think it depends, like I said, it depends on the employer, what their policies are, but having something in place for like loved one's illness or just like having a bit more compassion for what these people are going through is so important.
Absolutely, and thank you for sharing that. And it sounds like there's a lot of folks with lived experience or further thoughts on the caregiver experience in Canada. If there's anybody who's wanting to continue to have this conversation at another time with either Keela or the IFA, please do feel free to put your email in the chat. And we highly value your insights and experiences as caregivers, and would really appreciate to continue the conversation at another time as well. So please feel free to put your comments with your contact information as well. But we're slowly coming to a close here, so I have a couple last questions for you before we let you go here. But what are some ways in which caregivers have demonstrated resilience or have found meaning in their role as caregivers? And what are some of the positive experiences that caregivers have voiced to you?
Yeah, I think so many are just having time to spend with their loved one while they're still their loved one, and finding small ways to bond over their past, or like using music, like having a little dance party in the kitchen, or like I think the meaning is we've lived our whole lives together, and now at least in the spouse subset of caregivers, we've lived our whole lives together, and how do we make the best of this? humor has been, like I said, a huge source of resilience for many of the caregivers. Um, and I think that that's so inspiring to see. Um, and I could, as soon as I said dark humor is like a big thing in caregivers, it seems all of them kind of let loose a little bit. Um, and would tell stories and would laugh. And there's something really inspiring about that, I think.
Mm-hmm. No, absolutely. I think there's a lot of stigma and shame or isolation around the caregiver experience, but there's certainly a lot of resilience as well. And it's important to highlight that there's a lot of positive gained from the roles and responsibilities as a care partner as well. But just coming to a close here today, we have I guess my last question for you here is if you have anything that you just wish more people knew about caregivers or understood about the caregiver experience, specifically in Canada.
Yeah, I think that this is a role. It doesn't, hmm. I guess like we don't treat it as a job. And like in Canada, we really value jobs. And like, I mean, capitalism is a thing for a reason. Well, not for a reason, but why aren't we viewing this as a job too? Why aren't we supporting these people like we are employees who are experiencing burnout? I think sometimes we forget about the burden that comes with caring for a loved one with dementia, but in general, um, and just remembering that these people need support too. I think is really like, I guess very broadly, not forgetting about them in terms of our policy.
Mm-hmm. No, absolutely. We're right there with you and certainly want to continue to amplify caregivers' voices as well. But unfortunately, we're coming to a close here today, so I want to just take a moment to introduce next week's guest. So next week, we will be joined with Miss Shamita Rashid, and she will be discussing from theory to practice, implementing technologies for older adults in everyday life. So very much looking forward to that session as well, and please feel free to join us for that as well. But thank you so much for your time here, Kayla, and we really appreciate having you on and joining us in amplifying caregivers' voices. So thank you so much for all your expertise and for sharing your research with us as well. So thank you for your time.
Thank you so much for having me. It was really nice to meet everybody, and I really appreciate your comments and questions.
Wonderful. Thank you so much, everyone. Have a wonderful weekend.